before taking measurement of weight and measurement of height, you have to know how to measure weight of a child or weight of an adult person. Because if you do not adjust the machine and if you do not stand in an erect posture and if you do not look straight forward, your measurement will not be an accurate one. Clear? That's why before undertaking any measurement, maybe a child or maybe an adult person, you have to, first of all, you have to know whether machine is working or not. Suppose a machine was given to you and you are advised to take the weight of that lady. So if you do not know whether machine is accurate or not, you will be puzzled. So first of all, you have to know whether machine is working or not. Number one. Next, you have to adjust the zero. Suppose if the pointer is 10 at the level of 0, then the reading will be erroneous. That's why you have to adjust the zero adjustment. Know the adjustment. You have to adjust at 0 level. In some machines, there is a pointer. You have to rotate it either clockwise or anti-clockwise, and then the pointer will come at the 0 level. So first of all, you have to know whether machine is working or not. Then you have to adjust the 0 level. The pointer will be at the 0 level. After that, you will ask the child or the mother to undress. Not all dresses will be removed, but as far as possible, remove the shoes, and after that, ask him or her to stand like this in a V-like position and stand erect, straight forward at Frankfurt level. Frankfurt level means outer canthus of the eye and tragus will be in the same line. So you ask the person to look straight forward. Clear? Not like this, not like this. So you stand in the erect posture, in the V-like shape, and you look straight forward. After that, you have to note the readings. So you will not look like that. Oh, okay, 53, not like that. You have to illuminate the area, dark. So your reading will be erroneous. So light, sufficient light will be there, and you will note like this. Straight forward. Not obliquely. Clear? So these points you have to remember. Because in the final exam, at part 1 during university exams, you have to face the OSCE, objectively structured clinical examination OSCE. You have to face the OSCE. So in the OSCE, we ask the patient, we ask the students to measure the weight of this person. So you have to follow all these points, and after that you will record the exact reading. Here, this is the technique of taking weight of a under 5 child or of an adult person. Clear? Next is, this is the weight. Now, if the weight, what is your weight? 45. What is your weight? 56. So, just weight, it has got little meaning. Suppose if you say that I scored, say, 80 in biology, it has got little meaning. Until unless you say the denominator, it will be of little help. Similarly, weight has got little meaning until unless you say the weight of that person. So, age of that person. So, weight in respect of age. Clear? For under 5 child, weight in respect of height. So, you must say weight in respect of age weight in respect of height. Clear? So next is height. How will you measure the height? How will you measure the height? Any one of you? Say how? How will you measure?
Make the person stand on that.
Then
We'll ask the person to look straight.
Yeah.
The ankle should touch the rod behind.
Yeah.
And then unlock that skin and bring it to the height of his head.
More or less correct, but some rectification is needed. Suppose you want to take the height of a person. Before taking tape, measuring tape. Give me the tape. First of all, you have to mark with the pencil. It is 5 feet, more or less. It is 5 feet. You give a marking here with the help of pencil. You give a marking. Then you take 12 inches. That is 1 feet. So you mark here 5.5 feet. Then another 1 feet. So it will be 6 feet. So you give markings above, usually adult person 4.5 to 5 feet. So above 4.5 feet, you give markings at an interval of 2 inches or 1 inches as you like. So you give the markings. And after that, you ask the person, you stand. Before standing, you remove the shoes and you stand here like this. And you look straight forward. At that time, you give a cardboard over the head, and then you ask the person to stand on the side. Then you take the measurement. Clear? It is the easy method at grassroots level. At community level, you will go to the field, and at community level, you will not get the stadiometer. So you have to take the measurement of any person in this way. So this technique you have to follow. So it is the usual technique which we usually do at community level. We take the height, we take the weight, and another thing is the left mid upper arm circumference. Left mid upper arm circumference. For which age group left mid upper arm circumference is applicable? Is it applicable for 10 years old child? You have completed nutrition probably in the first or second year, so you should know. Any idea? You have got any idea? It is applicable only in the age group of 1 to 5 years. For 1 to 5 years, child will measure the left mid-arm circumference. How to measure? With the elbow, this point, you must, suppose you come here. Hold it. Feel the olecranon process, typical olecranon process. This is the elbow, and here the tip of the olecranon. Tip of the olecranon, আর এখানে আল্লাহর tip portion, elbow end. Clear? So this, suppose roughly this is 10 inches. So half, that is 5. At this level, you have to measure left mid-arm circumference. But this is not for adult, only for 1 to 5 year old child. Why? Because it has been found that during this period, muscle mass remains more or less same. What is the normal? What is the normal? It will be 12.5 centimeter. It will be 12.5 centimeter. Clear? If it is less than 12.5 centimeter, then there is some malnutrition. Okay? So you must remember what is the normal. It is 12.5 centimeter. For which age group it is applicable? No, 1 to 5 years. Why? Because muscle mass remains more or less same during this period. Clear? And how to measure? To feel the elbow and tip of the olecranon process, and you measure this length and you divide by 2, then it is half. So it is a midpoint, and you take the arm, the gut of the arm. Clear? So these 3 important measurements, you have to know the actual scientific procedure which you have to follow, because you have to pass the final exam. So you have to know what is the scientific procedure. Otherwise, you will be criticized. Suppose at undergraduate level you have passed, but after passing, you have to do the work at field level. So if you do not know the actual procedure, then you will be criticized at any point of time. So you must know how to record the weight, how to record the height, and how to record the left mid-arm circumference. Clear? Now you go to the library and you consult the books, what has been written. If there is any discrepancy, you can consult with me at any time, or any of our faculty. We are always with you for giving assistance in this matter. Okay? Thank you.